Welcome back to Daytime, everyone. Well, you can look good, sound good, and carry yourself well, but if you have bad breath, no one's going to like you. Welcome to the show now, Dr. Arun Narang. Thank you for coming back.
Thank you for being here.
Thank you for having me.
Okay, and I guess we kind of gave it away off the top there. Today we're talking about 7 steps to prevent bad breath. Why don't we just get right into it?
Yeah.
Okay, well, you know, if you suffer from bad breath, you know, you're not alone. There's a lot of people who suffer from bad breath, and if you're suffering from halitosis or persistent bad breath, it can be downright embarrassing, you know, and sometimes people don't even realize that they have a problem unless a loved one or their dentist or their hygienist tells them that, you know, they've got a problem.
And that's such an awkward, hard thing to tell someone. Like, how do you tell someone, hey, listen, you know, your breath stinks?
It's hard to kind of go over that barrier, especially if it's someone that you're not too close with. It's fine if you're a family member, but if it's someone you don't know.
Exactly.
But I just, what are some of the things that lead to bad breath? Some of the causes that lead to it?
So, I mean, there's a lot of different reasons for, you know, bad breath. You know, gum disease can, you know, sort of create a bad sort of odor in the mouth. So because there's different bacteria which are causing problems in the mouth, or there's, you know, a disease process there. So gum disease is the biggie. Cavities, you know, because if tooth material is rotting or, you know, there's decay present, then that'll have an odor to it. Those are the 2 top dental reasons. You know, other things such as oral cancer, dry mouth, you know, can also cause bad breath, and medical conditions can sometimes cause bad breath also. So, I mean, if you've done all the dental, ruled out all the dental issues, then sometimes it could be an underlying medical condition. Even plaque or buildup on the tongue. Some people don't avoid to clean their tongue or their palate, soft palate. That will also, bacteria on the tongue can also cause bad breath.
Okay, and we know obviously people are so busy these days with work and, you know, the internet and things like that. People are just go, go, go. For people who, you know, brush twice a day and maybe floss every other day or every day even, is that enough to prevent bad breath?
Well, I've got the top 7 sort of ways to avoid bad breath. So if that's okay, we could kind of get into it.
Let's do it.
So number 1, you know, I feel it's really important for regular dental checkups and cleanings. Like it's key, because I mean, even though you are looking after your teeth, sometimes you can't do everything yourself, and something could be happening that you're not aware of. So regular dental checkups and cleanings are key in my opinion. So that's number 1.
And that's about every 6 months, right?
For the average person, for the average person, every 6 months would be good.
All right.
And then number 2, make sure you're brushing twice a day. A lot of people will brush once a day and they won't brush the second time. Obviously, if you can do it 3 times a day, even better. Yeah. But brushing twice a day, because then you're not going to bed with plaque and buildup on your teeth, because overnight that's going to, you know, create more stuff that builds up in your mouth and leads to bad breath. So that's important. Flossing once a day is key, because the brush isn't going to reach everything. So if you're flossing, you're getting the food or, you know, stuff that may be building up, plaque that may be building up in between the teeth, and that can contribute to bad breath. So those are the top 3. If I continue down the list, number 4, mouth rinses or mouthwashes. But you have to be careful with that one, because some people will just use it to kind of mask persistent bad breath, and you know,
and as well brushing too. Instead of brushing, people might just do the mouthwash, and that's not good enough.
Exactly, it's just going to mask the problem. So mouth rinses are also beneficial.
They should be used to supplement kind of brushing and flossing.
Exactly.
Well, we have to take a break, Dr. Arun Narang, but we'll get to the other couple points when we come back. So don't go anywhere here on Daytime. Plenty more with Dr. Arun Narang when we come back. Hey everyone, thanks for staying with us here on Daytime. We're still joined by Dr. Arun Narang, and we're talking about the 7 steps to fresh breath. Now, we hit on flossing daily, as well regular checkups at the doctors, and you're just about to get into proper mouth rinsing. So if you want to kind of continue on with the other 5 steps, that'd be great.
So as I was saying, you know, mouth rinses are kind of, you know, they're useful, you know, not as important in my mind as brushing and flossing regularly, but again, it's a good adjunct or something that you could do. I personally prefer alcohol-free mouth rinses if you're able to find one. A lot of the over-the-counter products have alcohol, so be careful.
What's the benefit of not having alcohol in a mouthwash?
Well, again, the alcohol can, you know, sometimes the bacteria, you know, you'll mask the bad odor, but sometimes the bacteria can then multiply.
Oh,
you know,
and as well, it's I find the harshness. A lot of the mouthwashes that I use, it literally burns the inside of my mouth. I don't know if that's a good thing to get rid of the bacteria, or it actually is quite uncomfortable and painful.
Exactly, that can also happen. So ask your dentist or hygienist. They could recommend an alcohol-free product. You know, if you like using a mouth rinse.
All right.
And so we've hit on flossing, regular checkups, brushing, and mouthwash. Why don't you guide us through the final 3 steps here?
Right. So the final 3, I think it's really important that you use some sort of device to clean your tongue, whether it's your brush, or we could be using a tongue scraper. Like this is an OxyFresh kit, and the kit usually contains an alcohol-free mouth rinse, a toothpaste, some mints, as well as a nice tongue scraper. Some people will just prefer to use a brush, and that's okay too. So don't forget to really brush your tongue well and get back there in doing it, and do the sides of the tongue as well as to do the soft palate a little bit. Yeah.
And we have 2 more points to get to. We have about a minute left, so we can get right to the next 2 points.
So you want to avoid tobacco products if you can. It's just a given, you know, if you can avoid tobacco products, you know, smoking can lead to, you know, increased gum disease, obviously increased cancer, and contribute to bad breath, you know, so avoid tobacco products if you can. And lastly, try to avoid dry mouth. You know, as we age, or, you know, sometimes with certain medications or even medical conditions, we can get dry mouth, and dry mouth can lead to problems. So ask your dentist or hygienist about a saliva substitute. Sometimes that can help also if you don't have dry mouth.
And what's the symptoms of dry mouth and the gum disease? What are kind of the main symptoms?
Well, in dry mouth, you basically won't have, you'll always kind of have a dry feeling in your mouth. You know, you want to drink water, your mouth is dry, you're not producing enough saliva in your mouth. So if that's happening, and the other thing, you know, these are the common things, but there can be other medical things too that can cause bad breath. Sometimes bowel obstruction, diabetes when somebody's going into ketoacidosis, or you know, chronic kidney failure. So there can be medical conditions too. So if, you know, your dentist is unable to help you and you've gone through the basics and you have persistent bad breath, then you need to see perhaps a physician and get it checked out, because it could be a medical reason too.
Dr. Arun Narang, you're always very informative. You're welcome back anytime. Thank you so much. 7 steps to live by. We got to take the break. Plenty more on Daytime after this.